This is the Bartholomew Town Podcast.
Hey, everybody. Welcome into another edition of the Bartholomew Town Podcast. It's Bill Bartholomew here with you for new episodes every Tuesday and Friday. And, of course, well over 300 episodes in the archive at ripodcast.com and on Spotify or wherever you like to listen to shows. Today, I welcome in political and investigative reporter for the Public's Radio, Ian Donnis, and we discuss something that's a region-wide conversation, something that we've been featuring here on the pod a little bit and we'll probably continue to go in depth on, and that is the issue of, frankly, the business of hospitals here in our region. Ian has gone pretty deep into the minutia, and in particular, we're discussing today kind of the secondary conversation in the broad discussion on hospitals, that being the Prospect Medical situation involving Fatima and Roger Williams hospitals. You know, this is what Peter Nerona signed off on a few weeks ago, the $80 million escrow, the acquisition of these hospitals that make up the third largest chain of hospitals here in the state. And so we go into the weeds on that, but particularly going back a little bit, Ian got a tip last year on the Health Services Council that they were approving an inpatient rehab unit in Johnston by a company with a checkered past, even though a state consultant found that the unit was not needed. So we go all the way back to last year and take a look at the ins and outs of what is the Health Services Council, how does that impact all that is going on in this broad conversation, again, on hospital mergers and acquisitions and so on and so forth here in the state. And what does it mean for you? I mean, most importantly, right, that's what this is all about. What does it mean for you out there as a listener, as someone who is a resident of, or someone who works in or studies in Rhode Island, or just cares about the state? Maybe you're listening from Florida right now, and you know this is something that'll impact potentially you in a different group of hospital mergers or companies down the line. So a fascinating discussion with the one and only Ian Donnis right here on B-Town, which you may support by visiting our Patreon account, patreon.com/BartholomewTown, or simply click the support link wherever you're listening. For as little as $3 per month, you may help to sustain the independent journalism, opinion, analysis, and entertainment that we provide. And if you go to that $10 per month level, you'll get exclusive content. Most recently, I posted my rant on why Narragansett Town Beach should not allow the recent brawl at the beach that took place to serve as an excuse for their gatekeeping practices. If you want stuff like that, it's patreon.com/BartholomewTown. Okay, let's get to it. Ian Donnis of the Public's Radio, Rhode Island's NPR affiliate, right here on Rhode Island's podcast of record, B-Town.
Dr. Bartholomew.
Yes, the iDog entry. I love the grand entrance there, the anticipation with a red backdrop, and then I was hoping the curtain would come up, actually, as you entered, but
I'll try and make up for that with some witty insights, if possible.
Absolutely, yeah, for sure. I mean, you've got quite a backdrop there, I have to say. It's well, you would be well rated on the Room Rater scenario.
Nice. Yeah, I think I would like to be in front of one of my bookcases loaded with all kinds of great books, but my pandemic office is actually in our dining room, and I wouldn't want the bright light from the window to be shining in behind me. So the drape is drawn, and I'm glad you appreciate it.
All right, so today, I mean, we have an interesting discussion here. This is a hot button issue in Rhode Island. I mean, broadly speaking, hospitals, it's something we've discussed with Brian Alexander and with others here on the pod, and it's a statewide conversation, but sort of nuanced. You're reporting on the Health Services Council, and I'll read from a Public's Radio piece. This is, I'll read the headline here. This is by Ian. As Rhode Island's two largest hospital groups pursue a merger, and that being, of course, Lifespan Care New England, a fierce battle is playing out over the control of the state's third biggest hospital group. Charter Care Health Partners includes Our Lady of Fatima Hospital in North Providence and Roger Williams Medical Center in Providence, which are among the largest employers and biggest taxpayers in their communities. And of course, we're taping here in early June, and very recently, when the listeners hear this, Attorney General Nerona approving with strict conditions essentially an escrow, basically money to make sure that these organizations don't go under and leave taxpayers on the hook. Talk about your reporting And let's get into the issue, and specifically with respect to the Health Services Council. You've been following this story in depth for quite some time.
Yeah, and thanks for having me, Bill. I've been a reporter in Rhode Island for more than 20 years, and I had never really known much about this advisory group that is part of the state health department called the Health Services Council. It came on my radar last year. I got a tip that the Health Services Council was poised to approve a $42 million rehab facility in Johnston for people who have like broken hips or strokes or things like that. And the thing that was noteworthy was that a consultant for the state found that this proposal was not needed, that only 62% of the existing rehab beds were used statewide in 2018, and the consultant thought that the state had enough rehab beds to last for another 10 years. Mayor Policina understandably saw this as kind of a pro-growth thing. He likes the idea of building stuff in Johnston. The local officials were behind it. So this wound up getting approved on a 3-2 vote last year by the Health Services Council, which is just an advisory group. That was noteworthy because that was less than half the membership of the Health Services Council. And as I subsequently found out, one of the members who was planning to vote was effectively knocked out of the vote by a lawyer for the proponents. There were a lot of interesting issues to dig into here. That's when I started paying closer attention to the Health Services Council. We can get more into depth on some of these related topics, but of course, the Health Services Council had the job of vetting the proposed change in ownership for the charter care hospitals, Roger Williams Medical Center in Providence and Our Lady of Fatima in North Providence. This is Rhode Island's third largest hospital chain. This story started developing last year. It didn't really get barely any local attention. A lot more people were focused on what was happening with the possibility of an academic health system between Brown University, Lifespan, and Care New England. And, I think there's just not the same degree of scrutiny of the hospital landscape that there was years ago in Rhode Island. But I started following this, and, some out-of-town media sources like ProPublica and the Wall Street Journal started paying attention to it because the owner of the charter care hospitals is very controversial. And but we can get more into that. But that's kind of the overview of the situation.
And that owner, Prospect Medical Holdings, or I don't know what they call themselves, but yeah, and you've heard ads. If you listen to local radio or even in other places, you've seen sort of negative ads, pro ads about this. And you're totally right, because it's so easy for the average, even person who is into Rhode Island news or media, politics, whatever. You hear hospital and you think, oh, the merger, as you said, the academic health system, the Care New England Lifespan merger, integrating Brown University. And this just sort of gets put into like that too. That's happening too. But it impacts people, particularly as we've learned through COVID, how important localized urgent care, even long-term care is. And the money that's involved in all this, the business of hospitals, is something that should be front and center for every person who lives in Rhode Island or anywhere for that matter.
Absolutely. I mean, it's huge. I mean, in the course of my reporting on some of these issues, I spoke with a guy who's a healthcare economist at Boston University, and he asked me how I thought spending on healthcare compares to U.S. spending on the military and defense. And the amount spent on healthcare dwarfs the amount spent on defense and the military. And we know the amount spent on defense is a ton of money. So that tells you something. And the Health Services Council is kind of one of those obscure groups that not a lot of people know about in Rhode Island. And I started paying closer attention to it when they voted for this all wound up happening differently due to the involvement of Attorney General Peter Nerona, as was reported by a number of sources recently, in terms of this proposed change of ownership of Prospect Medical. Prospect was owned has been owned about 60% by a private equity group in Los Angeles called Leonard Green Partners. There's a senior executive with Prospect named Sam Lee and his business partner, David Topper, who owned 40% of Prospect. And basically, Lee and Topper wanted to take over the whole company. That was what was under consideration in Rhode Island. There were a couple of things that raised questions about it. The purchase price for 17 hospitals across the country was just $12 million for these two guys to up their share from 40% to 100%. That's obviously barely any money at all when you're talking about 17 hospitals. And, the lawyer for Prospect downplayed the significance of this change, but there were the union at Fatima, the United Nurses and Allied Professionals, and other critics were kind of comparing Prospect to robber barons. And there were a number of reports about how Prospect and Leonard Green Partners took hundreds of millions of dollars in dividends out and paid them to various investors, including senior executives with Prospect Medical, the two guys who are looking to take over the company. We should note that Roger Williams Medical Center and Fatima they're the kind of hospitals that have to show anyone who shows up. They are safety net hospitals. So, if you don't have insurance and you show up with a gunshot wound or a broken arm, they have to treat you. At the same time, they switched from nonprofit to for-profit ownership when they were taken over by Prospect. And there was this debate about whether Prospect had improved care. Supporters of Prospect say it had improved care, but if you talk to the union or other folks, say there was a real bottom line oriented approach that resulted in less equipment and more of a focus on maximizing profit.
Yeah, and that of course is the big danger that our society faces when Brian Alexander, who was on a recent episode you can find in the archives not too far down, did a great deep dive himself. He wrote a book called The Hospital, and he's a Los Angeles-based journalist and author. And one thing that he compared hospitals to is, what if we had this sort of privatization for-profit model in drinking water or something else that's basic and essential? And it really asks major questions about this structure of our society and how we want to see the world. I mean, it's a really broad topic, but zeroing back in here, the Health Services Council, who sits on that? Who are they? Are they appointed, and who appoints them if they are appointed?
Sure, good question. The council usually has about 10 or 11 members. The appointees come from the governor, the House Speaker, and the Senate President. They're supposed to represent some different industries like the insurance industry and things like that. And one thing that I documented in my reporting was how on two of the most significant issues considered by the council over the last year or so, the council voted with less than half of its membership. And that kind of raises a lot of questions when you think about it. I mean, how would we feel if the Providence City Council or the General Assembly was taking votes on key issues with fewer than half of the members in attendance? The Health Services Council also, a lot of times, members recuse themselves due to conflicts. And, people can debate about whether that's because Rhode Island's a small state. And, a lot of times when you get professional people involved, it's not surprising that there are some connections. But there have been legislative proposals for a few years to expand the size of the Health Services Council so that even if some people have to recuse themselves due to a potential conflict, there would be more members considering an issue. Yeah, but I'm sorry, did I get away from your question?
No, that's a perfect question, perfect answer to that question. And it makes perfect sense. And we have a lot of these groups. I mean, we're seeing it in the Equity Council with respect to COVID that, these are out of public view largely, either intentionally or just based on the nature of detention span of the general public.
If I could just add one thing, Bill,
please,
to kind of come back to your question. I mean, I think sometimes the people on the council have some knowledge of healthcare. Other people are lawyers or, from the insurance industry. But one really striking thing about the proposed change of ownership involving Fatima and Roger Williams Medical Center, the Health Services Council was told in April that Prospect Medical Holdings last year had more than $1 billion more in liabilities than assets. That's a pretty attention-getting piece of information. At the same time, the council had held a series of meetings on this proposed ownership change. The council members were perhaps drowning in paperwork. It's a complex issue, but Prospect was insisting that this was just kind of a technical change and there were no serious potential consequences. But Attorney General Peter Nerona, who has some oversight responsibility here with the health department, took a really serious look at this, and he basically backed up the concerns that had been cited by the Nurses and Allied Professionals Union and other critics about how Prospect had operated in what Nerona characterized as kind of a greedy fashion, and how the company could face a liquidity crisis within 1 to 2 years. That raises questions about the future of Roger Williams Medical Center and Fatima. They're among the largest employers in Providence and North Providence. They care for a lot of people. Nerona really, I think Nerona's role is noteworthy because he really took a careful look at this at a time when a lot of elected officials were ready to sign off on this change in ownership. I mean, Sabina Matos, now lieutenant governor, back when she was president of the Providence City Council, was among the elected officials who spoke in support of this ownership change. And, Nerona has insisted on this $80 million escrow account to cover operating expenses and capital improvements for Fatima and Roger Williams Medical Center, so that if there's a shortfall, that there's more accountability to make sure that these institutions are able to continue into the future. And, that was a great interview you did with the guy who wrote about the hospital. And I think his point was how we're in this situation now where if you have a decent job and you have health insurance, maybe you're paying a little more than you were 5 or 10 years ago, but you're in pretty good shape. But we have an employer-based healthcare system. So if you don't have a job, or if you're underemployed, or you're a freelancer, your healthcare can be a lot less certain. And to go back to what Mr. Alexander said, comparing healthcare to something like water, I mean, should good healthcare be something that only people of a certain economic income should have access to, or is it basically a human right? And that's why we hear debate in Rhode Island and elsewhere about Medicare for all and that kind of thing.
Absolutely. And I caught up with Governor McKee just 45 minutes after Attorney General Nerona's announcement. That we're recording early June again. I think this was last week. I'm losing track of time. When the general made his announcement about the escrow account and sort of signing off on this transaction with respect to Prospect Medical. And the governor said, look, I fully agree with the general's decision, and his scrutiny appears to be what we need. So, the general sort of converting a lackadaisical approach to at least some scrutiny in the executive branch. I want to ask about your reporting and where it goes from here, because this in many ways is just getting started. We'll take a quick break. You're listening to the Bartholomew Town Podcast, Rhode Island's podcast of record. I'm Bill Bartholomew. We're here with the Public's Radio's Ian Donnis.
If you're planning to get a COVID-19 vaccine, there are 3 ways to make that happen in Rhode Island. You can choose a state-run vaccination site, a regional or community-based clinic, or certain pharmacy locations. To learn more about all of these options, start at c19vaccineri.org. There, you'll find all the information and links you need to make a decision and to schedule an appointment. That's c19vaccineri.org.
Okay, so you have been really on top of this story, nuanced, big picture. It's something that you've, in many ways, you've been focused on. I mean, you're obviously focused on a multitude of things. Where do you see it going from here? What are you looking for not only with Prospect, but just with the broad healthcare conversation in Rhode Island right now? What's something that you're going to be monitoring that the average Rhode Islander should know about?
Well, I think part of what is interesting is, do we have a deliberate plan for the hospital landscape in Rhode Island, or are we just at the mercy of what public and private entities decide to happen? And in talking with Attorney General Peter Nerona, he told me that in his view, Rhode Island has not had a real thoughtful plan for its hospital landscape since the late 1980s. I know there was something done when Elizabeth Roberts was lieutenant governor a number of years ago, but it seems like what often happens is dictated more by the private marketplace than the state having a strategy meant to improve the healthcare of all Rhode Islanders. And we know the state does really well on some health indicators, like the percentage of children who have health coverage is very high, and that's great. But I think part of what bears watching is what happens with the charter care hospitals, Fatima and Roger Williams Medical Center, after 5 years. The conditions imposed by Attorney General Nerona are 5 years. That is dictated by the state's Hospital Conversions Act. So, will Prospect try to sell to some other entity? Of course, there's a lot to watch with the envisioned academic health system between Lifespan, Care New England, and Brown University. I'm hearing whispers of concerns about how the federal government may come down on this, and will there be concerns that this would be too much of a monopoly, and will one or both of these hospital groups have to shed some of their holdings to win federal approval? That is a big story that bears watching. Also, the cost factor. We had Brown University Christina Paxson as a guest on our weekly show on the Public's Radio a couple of weeks ago. She told me that she thinks this envisioned academic health system with Brown, Lifespan, and Care New England will benefit consumers and lower healthcare costs. But, my understanding is that in a lot of places that the opposite has been true, that kind of conglomeration, even if it helps to create a lot of jobs and a lot of healthcare spending, that the impact has not always been good for consumers. So that's something worth watching. And, as you know, Bill, I'm the political reporter for the Public's Radio. There's a lot that's political about healthcare, and that's kind of been my prism for looking at some of this. I do a lot of bread and butter coverage of more straightforwardly political issues, but it is interesting to look at healthcare because that becomes part of the political debate. We saw that with Bernie Sanders. It was some people thought he was the flip side of Donald Trump as a populist from the left rather than the right, and that a lot of support for him from young people came from his approach on healthcare. So these debates about how do we get healthcare as Americans are not going away. And I think, the business issues can be complex and somewhat abstract, but it's incumbent on people like you and me to help break that down and make it understandable for people in Rhode Island so they can weigh in and, let their elected officials know how they feel about it.
Yeah, the old sausage making adage and how this is something that, speed bumps can be annoying, and, the decision as to whether or not, the General Assembly is going to take down the plexiglass. All right, does that affect the average Rhode Islander? Maybe not. This does, though. This definitely 100% impacts everybody, and it's as important as any other issue. Yet, as you had alluded to at the open here, it's sort of been in part obfuscated by the larger healthcare question with a merger in academic health system. But I think just broadly speaking, it's off most people's radar screens.
Yeah. And it's, politics is your quality of life. Politics is the quality of the air you breathe, the water you drink, the schools your kids go to, and your health care. So, I think there is a serious role for the news media in Rhode Island or anywhere to focus in on some of these business questions and to keep an eye on some of these things that are playing out behind the scenes.
Ian Donnis, political and investigative reporter at the Publix Radio. I wish we could have your voiceover guy say that. I just love the Publix Radio, and that's big time stuff there. And of course, a number of different ways you can access that station in terms of an FM signal or the publixradio.org. Twitter at Ian Donnis is also a great place to spend some time if you're looking for this stuff.
Thanks so much for having me, Bill.
Absolutely.
Rhode Island's podcast of record, B-Town.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.